Good afternoon. Today I'll continue to talk about the coronavirus and the latest updates and news. So the first thing I'd like to talk about is that restrictions are slowing coronavirus infections according to new data. So I think a database of daily fever readings show that the numbers declined as people disappeared indoors. So currently there's about 248 million Americans in at least 29 states to have been told to stay at home. So this is part of social distancing and keeping 6 feet away from people when you are outside. What has happened is that a company, Kinsa Health, produces internet-connected thermometers, have created a national map of fever levels on March 22nd and was able to spot the trend within a day. So the data from health departments of New York State and Washington State found that social distancing is currently saving lives. So there was many doubts about if this was going to work. So many people thinking that social distancing wasn't going to stop and it was going to be ineffective. But Kinsa has more than 1 million thermometers in circulation and has been getting up to 162,000 daily temperature readings since the coronavirus began to spread, and it has already showed fevers. The map showed fevers holding steady or dropping almost universally across the country. On a broad swath of New Mexico, where the government had issued stay-at-home orders only the day before, there was already evidence that the number of fevers were dropping, and by last Friday morning, fevers in every county in the country were on a downward trend, which is in shades of blue on the map. And around here, the entire country on Monday, 3/4 of the country was deep blue, while a separate display of collective national fever trend spiked upward. On March 17th, it has fallen below the band, showing historical flu fever trends. So this is really impressive because it has shown how social distancing is in fact saving lives and can counter these people who don't actually believe that it will work. So the second thing I'd like to talk about is that the Centers for Disease Control and Prevention is reconsidering its guidance that people do not wear masks. So before, the CDC and the World Health Organization repeatedly said that the general public does not need to wear masks, and as healthcare workers face shortages of N95 masks and protective gear, public health officials have warned people not to hoard masks. But Dr. Robert Redfield, the CDC director, told NPR on Monday that the agency was re-evaluating its guidelines because there was data showing that as many as 25% of infected people remain asymptomatic. Basically, they don't have any symptoms, but they already carry the virus in them. This is important because now you have individuals that may not have symptoms, they don't know that they have symptoms, and they are infecting people currently. And so masks might cut down spread from these people, and so now the CDC is currently aggressively reviewing these rules. People who are just becoming ill may already be infectious up to 48 hours before they show symptoms. So this is how rapidly this virus can continue to spread across the country, because we have asymptomatic transmitters and we have individuals who are transmitting 48 hours before they become symptomatic. So, like I said before, Hong Kong and Taiwan have already jumped into action early with their universal mask wearing and social distancing, have gotten their coronavirus cases under much great control. The value of the mask isn't necessarily to protect you from getting sick, but it will offer some infection. Social distancing measures all in all is really important, and I think so everyone should wear masks to protect themselves if they go outside, but don't unnecessarily hoard masks. because that's just harmful for the healthcare workers and to other people around you. So just, I think the most important thing is that you should wear a mask, unlike before where they're saying that you shouldn't. I think actually that you should, and take action before the CDC officially says anything. The third thing that I would like to talk about is that I think today the Wall Street has dropped to its worst since 2008, with the S&P falling 12.5% in March as the coronavirus decimated the global economy. So the Wall Street finished its worst month since 1987, before later recording its best 3-day run since 1933, when oil prices crashed and interest rates plunged. And so on Tuesday, the stocks fell nearly 2%, and calmer markets do not mean the worst is over. So before, these smart stock markets are just dropping a lot, then increasing a lot, so it's extremely unstable. And now March was its worst month, and so even with the huge 2 trillion, I believe, economic stimulus plan, the stock market still hasn't been doing extremely well. And so let's just hope that the economy tries to stabilize before everything is just getting out of hand. And yeah, so that's it. Thank you for listening, and I hope you have a good day.